Hello, I'm Andrew Kaunitz, Professor and Associate Chair in the OBGYN Department, University of Florida College of Medicine in Jacksonville. Today I'd like to discuss a new study which revisits systemic combination menopausal hormone therapy and risk of breast cancer. In the 4 decades I've been in practice, the main safety concern patients have expressed regarding menopausal hormone therapy, or HT, is that it might increase risk of breast cancer. Given how common breast cancer is, and that most breast malignancies have hormone receptors, angst regarding HT use and breast cancer is understandable. The Women's Health Initiative, or WHI, which represents the largest placebo-controlled trial of HT, assessed oral conjugated equine estrogen, or CEE, combined with the synthetic progestin medroxyprogesterone acetate, or MPA, in participants with an intact uterus. A WHI report with more than 20 years of follow-up found that the incidence of breast cancer remained modestly higher among participants with an intact uterus randomized to CEE plus MPA, with a relative risk of 1.28. Since initial WHI findings were published in 2002, there has been much interest in assessing if the type of progestogen, a term which refers to bioidentical progesterone as well as synthetic progestins, makes a difference with respect to risk of breast cancer. Similar to WHI findings, among participants with an intact uterus in a 2005 French prospective cohort study who used estrogen along with progestins, mainly MPA, the risk of breast cancer was significantly elevated. However, no elevated risk of breast cancer was noted among women who used estrogen plus bioidentical progesterone. One limitation of this French study was that the overall number of women with breast cancer was less than 1,000. In the June issue of ACOG's Green Journal, a landmark case control study using a UK database derived from British family medicine practices, representing more than 7% of the total UK population, examined how different types of HT formulations were associated with risk of invasive breast cancer. In this report, which included over 43,000 cases of breast cancer, investigators found that among women who used estrogen plus synthetic progestin, almost all of which was MPA, the odds ratio was 1.28, identical to the long-term follow-up of WHI participants who were randomized to CEE plus MPA. However, among women who used estrogen plus bioidentical progesterone, no elevated risk of breast cancer was found, consistent with the French study. In the transcript which accompanies this video, I refer to practical issues when prescribing progesterone as part of combination menopausal HT. To conclude, this new report based on British data will change how I advise my patients with an intact uterus regarding combination HT. I'll counsel patients that from the perspective of breast cancer risk, the safest progestogen appears to be micronized progesterone. I'm Andrew Kaunitz. Please take care of yourself and each other.